Hello, and welcome to our presentation, Debride from a Distance. My name is Giselle Valentine. I'm a registered nurse, and I am the Director of Clinical Affairs for Hydrofara. Wound bed prep is key in order for a wound to heal. It's the foundation of the wound healing. But before we even look at localized wound care, we want to make sure that we address or treat the cause of the patient. We want to also look at patient-centered concerns before we even look at localized wound care. When we start considering localized wound care and we discuss or look at wound bed prep, we need to address the DIME principle: debridement, infection and inflammation, moisture balance, and edge effect. But for the purpose of today's presentation, we're going to focus on debridement. So why do we debride? We know that it helps us in preparing that wound bed. It removes that devitalized or that necrotic tissue. It also removes or disrupts that biofilm within the wound bed, helping to promote and stimulate growth factor activity and reduces MMP activity and also that bacterial load. Therefore, when we manage all of that, we're going to now reinitiate that wound healing cascade. So we know that there are many types of debridement, and there are pros and cons that we can consider as we look at all of the different types of debridement that are out there, from sharp debridement, mechanical, enzymatic, biologic, and autolytic debridement. We're going to talk today about autolytic debridement that typically is a selective, safe, and painless form of debridement for the patient, and ideal for those clinicians that are unable to provide sharp debridement. So why are we talking about debridement from a distance? We know that as a result of the pandemic of COVID-19, that there have been many restrictions that have been placed on the healthcare settings. Telehealth has been used more than ever since this pandemic began. And also, it's really caused us to really focus on our particular scope of practice and how it affects what we can do in the community and for our patients. So, how do we ensure wounds continue to progress if we cannot debride? So this provides us a lot of challenges and also more opportunities as to how we can coordinate the plan of care for our patients in the home care setting. Some of the things that we need to consider though: what is the access to wound expertise at the bedside? Who is going to actually be providing the care to the patients in the home? We need to be able to recognize wound bioburden and biofilm. Is there something out there that will help us give us an indication of whether or not we're managing the bioburden and the biofilm? And then a big one, especially in the community setting: wound hygiene in the home. How are we going to maintain or provide a clean environment to give the patient's wound optimal healing? So what do we do, and how do the choices that we make affect how we're going to debride and do some wound bed prep on a patient's wound? Sharp debridement is not always an option. This COVID-19 pandemic really had patients afraid to leave their homes and go and follow up on the wound center as they should, or some of them may be concerned about letting clinicians, caregivers in their home to provide the care as well. Can patients tolerate certain types of debridement? And also, how does that affect their pain level? We need to again consider the care setting. Many of the patients are being seen now in the home care setting. And when we look at that, what is the clinician's scope of practice as it pertains to debridement? Are they allowed to do sharp debridement? And then cost, again, may be a factor. What are we going to do? How are we going to manage the cost and all of these factors as we decide what we're going to do as it pertains to debriding of a wound? So access to care. There is help. Hydrophobic Blue Classic, the polyvinyl alcohol antibacterial foam. Hydrophobic Blue Classic is a very unique polyvinyl alcohol foam that has a distinct mechanism of action. It's about the closest thing as you'll be able to get to natural sea sponge, and therefore has that natural negative pressure, that natural pull from that capillary pull. It therefore will wick away that bacterial-laden exudate away from the wound bed itself, removing slough and devitalized tissue. What's really nice about the Classic and really the Hydrofara portfolio is that the kill of the bacteria actually occurs in the foam itself. So here's a video that's really showing and demonstrating that pull. You can see how the foam is just pulling away at the drainage itself. That's showing you or demonstrating that natural negative pressure, that natural pull. Just envision that in the wound bed and how it's going to be pulling away that bacterial laden exudate. So as you hydrate it and when you pull it into the wound bed, it's going to be removing all of that devitalized tissue and the exudate. This is showing you that Hydrofara Blue as a portfolio has a broad spectrum antibacterial coverage, non-cytotoxic because you have two organic pigments, gentian violet and methylene blue, that are bound to the foam. Again, the kill of the bacteria happens in the foam. And more importantly, it does not inhibit the growth factors. So let's talk a little bit about the Applewhite study. The Applewhite study is a comparative in vivo preclinical porcine study. And what he wanted to do was he wanted to evaluate how effective common treatment modalities would be at breaking down 100% eschar. So what Dr. Applewhite compared was the control was a moistened telfa. He used medical grade honey, collagenase by itself, Hydrofara Blue Classic by itself, or a combination of Hydrofara Blue Classic with the collagenase. What he found was at the end of 2 weeks that the Hydrofara Blue by itself or in combination with the collagenase was statistically more significant at breaking down eschar than any of the other treatment modalities. This picture here really shows how the wicking ability of the Hydrofara Blue Classic actually removes slough, devitalized tissue, and we also have a Canadian claim that it does disrupt biofilm. I love this case right here. I think every home care nurse has come into a patient's home and has seen a wound that looks like so. You come into a patient's home and you have 30, 40 to 100% of devitalized or slough covering the wound bed. What options do you have? You can't do sharp debridement. What are we going to do? Especially if you're not able to get that patient in to the wound center because of transportation or scheduling, etc. We can really halt or stall the clinical outcomes or the positive clinical outcomes with a wound as such. So this is a case that was submitted by Dot Weir, and she only used Hydrofara Blue Classic. So let's look here at the beginning. You can see all of that devitalized tissue. And looking at the location of the wound, that may or may not be an area that may be safe to sharp debride anyways. But she used Hydrofara Blue Classic by itself, and we can see here 5 days later, all of that necrotic or devitalized tissue was removed. In addition, we can see all of the peri-wound edema as well has been removed, and those rolled edges have also been flattened out by using Hydrofara Blue Classic. This is another case to show you a before and after how well Hydrofara Blue really aids in that autolytic debridement process. Look at all of that slough and devitalized tissue that has now been removed. If you have a wound that has rolled edges, we know that that wound is now going to be stalled in that inflammatory phase of wound healing. And once again, if the patient is at home and it's beyond your scope of practice that you cannot sharp debride those rolled edges away, you now have a tool in your tool bag that you can use the Hydrofara Blue Classic by overlapping those rolled edges about 1 to 2 centimeters larger. You will get the flattening of those rolled edges. And we can see that this occurred in 19 days in this case. So debriding from a distance, really, how can we safely debride a wound when you physically can't see your patient, especially if you're a clinician and the patient is a wound center patient and the patient cannot come in for their visit? Again, you have an option with Hydrofara Blue Classic. The nature of this polyvinyl alcohol foam, it wicks that bacterial laden exudate away from the wound bed itself, and it actually removes all the slough and debris, and it's very safe, it's gentle, and cost effective. One of the things I like to highlight about the Hydrofara Blue Classic as well is we talked about that bioburden piece, and you will get a visual indicator of what the bioburden is doing in the wound bed itself. So we can see here that the level of the bioburden within the wound bed turned the Hydrofara Blue Classic white, If it turns white, that means it's lost its fight. It's time for you to put another piece on. However, at some point in time when the bioburden is managed, the blue will stay blue for the 3 days. So if it stays blue, it can be changed in 72 hours. Again, that's going to give you a visual indicator of what's going on with the bacterial load or the bioburden in the wound bed itself. The Hydrofara Blue portfolio, in particular, we're talking about the classic, is very easy to use. It's very easy for you to teach family members and patients how to apply this dressing. But just so that you know, we do have Hydrofara Blue patient user guides and application guides that are available in French, English, and Spanish. So when we talk about debriding from a distance, we now have talked about the benefits of this unique polyvinyl alcohol foam in our Hydrofara Blue Classic. It's ideal for doing safe autolytic debridement. It's compatible with enzymatic debriders. It simplifies the debridement procedure so that even a patient's family or the patient themselves can apply this dressing safely at home. It's gentle and it's effective, and it painlessly removes that devitalized tissue from the wound bed. It reduces the sharp debridement procedures, and also is less costly. And let's remember, again, it's optimal for those patients when they cannot get into the wound center to have their wounds debrided. You now have a safe option that they can use at home. And it also provides that patient's comfort. So thank you for watching our presentation. For more information on Hydrofara's products or to request samples, please call our customer service at 1-860-337-7730. Thank you and have a great day.